Thank you all for being on the call this evening. My name is Donna Hill, and I work with the North Carolina Council of Churches on the Partners in Health and Wholeness Initiative as the opioid response and harm reduction coordinator. And we have what's going to be a great webinar tonight. I'm really excited. We have Elizabeth Brewington here. She is from the North Carolina Association of County Commissioners, and she's going to be talking with us this evening about the North Carolina opioid settlement funds and how faith communities can help advocate for that. And so just real quickly, I have something in the middle of my screen I'm trying to get rid of so I can see my screen. There we go. So just to quickly go over the agenda, we'll do a couple of introductions. We'll do just a quick centering. I'm going to talk real quickly about what the North Carolina Council of Churches and Partners in Health and Wholeness is, and then I'm going to turn it over to Elizabeth. So just for a quick centering activity, if everyone can just kind of think about about today and the blessings that you've had today that have been brought into your life, and opening up your heart and your mind and your spirit to this information we're about to receive tonight. I think it's really going to be helpful to some faith communities. So just take a second just to kind of center yourself and focus, and we will go ahead and get started. Okay, so who are we? So the Partners in Health and Wholeness is actually an initiative of the North Carolina Council of Churches. And the North Carolina Council of Churches was founded in 1935. So been a long time. And the PHW initiative, or the Partners in Health and Wholeness initiative, began in 2009. The Partners in Health and Wholeness, we focus on different health topics with faith communities, health ministries across the state. Stephanie, I'm having trouble advancing my slides. If you can help me, I'm not sure what's going on. Okay. So what we do, we work to bridge issues of faith, health, and justice, empower faith communities to improve their health and well-being, and partner and support grassroots efforts to challenge injustices. And we do it by providing resources, connections, and support to faith communities and their health initiatives. We work to establish trust and partnerships. And when the opportunities are available, we sometimes are able to offer mini grant opportunities to help financially support faith communities' health initiatives. And we do it because we believe all people are loved by God, that God cares about the wholeness of humanity and communities, mind, body, and spirit. And we work in partnership with faith communities to improve health outcomes of people across the state. And this is our current Partners in Health and Wholeness team. So we have Dr. Reverend Arlisha Simmons, who's our East Regional Associate Director. That's a lot of words. And Reverend Carolee Hall, who's our West Regional Associate Director. And we have Stephanie Sanders, who's our Program and Engagement Administrator, and she's actually on the call with us tonight. She's going to give you a little wave. Oops. So I am going to stop sharing, and I'm going to turn it over now to Elizabeth so she can start her presentation.
Good evening, everyone. It is so nice to be on this call with y'all tonight. My name is Elizabeth Brewington. I'm the manager of health programs for the North Carolina Association of County Commissioners Opioid Settlement Technical Assistance Team. So the North Carolina opioid settlements are a series of bankruptcies and settlements that are coming into North Carolina that nationally are over $50 billion, billion with a B, are coming to all the states as a result of these settlements. North Carolina in particular will be getting $1.4 billion over 18 years. So the funds started coming in about 2 years ago and will continue on for the next 15, yeah. So North Carolina is unique in that we are the only state in the country where 85% of the funds go directly to local governments. So that's all 100 counties and 17 of our largest municipalities. And then 15% goes to the General Assembly in the state of North Carolina. So we have this wonderful resource called Core NC or ncopioidsettlement.org. And on this, you can find what is called the payment schedule. So you can see how much money is coming into North Carolina over the total of 18 years. But you can also go to this drop-down menu and select your local county, or if you have a municipality that is getting funds, and you can see how many funds are coming to your specific area. So in North Carolina, we have something called the Memorandum of Agreement, which is the contract that governs the settlement funds. And the Memorandum of Agreement has 5 broad requirements that all counties receiving funds must follow. The first is to establish and use a special revenue fund. So this means that opioid settlement dollars are in their own special account and can only be used for opioid settlement spending. All local governments must authorize spending ahead of time. So this means they must pass a resolution to say, we intend to spend the funds on X, Y, and Z. There are 2 exhibits that outline the menu of options that local governments can choose that we affectionately call option A and option B. And so local governments have to follow those menu of options. Additionally, all local governments receiving opioid settlement funds must follow annual reporting requirements. So there is some annual financial reports and annual impact reports that all local governments must turn in if they're receiving opioid settlement funds. And finally, they must hold an annual public meeting, and I'll have more on that later. So as I mentioned, the Memorandum of Agreement has 2 main options that local governments can choose from. Option A is a list of high impact strategies that are really targeting the people at closest risk for death. These strategies can be picked at any time and local governments can invest their funds in them. Or local governments can invest in strategy B or option B, which is a longer list of strategies, a more expansive menu of options, but they must go through a collaborative strategic planning process first. So this collaborative strategic planning process is outlined in Exhibit C in the Memorandum of Agreement. And we like to say it is like a funnel. Local governments have to consider the universe of ideas, the root causes of the overdose crisis, and then filter down into the specific strategies they want to fund. So once they've gone through that collaborative strategic planning process, they're then able to pick from that longer list of strategies. So in North Carolina, we have learned from the past and the history of the tobacco settlements, and we have made sure that in keeping with the national settlements, all funds must go to support programs or services that serve people with opioid use disorder or co-occurring substance use disorder. So all these opioid settlement funds must go towards opioid settlement spending. So as I mentioned, option A is the list of 12 high impact strategies that are focused on the people closest at risk for death. And so I'm going to talk about those 12 first because that's what the majority of counties are picking. The first is collaborative strategic planning. And so this is really so counties have a chance and local governments can think about what is needed in their county. We know that the people who are closest to the problem are often closest risk to the solution. And so this is a chance for picking option one for counties to listen to their stakeholders and really figure out what are the gaps and their needs in their communities. And faith communities are a great way to fit into this process and say, this is what gaps we're seeing. This is the needs we're seeing. And we want to help make sure that the county knows these issues. Strategy 2 is evidence-based addiction treatment. This is according to the American Society of Addiction Medicine's definition of addiction medicine treatment, which means medications for opioid use disorder. We know that medications for opioid use disorder is the gold standard of care. And so this strategy is all about making sure that people can access this life-saving medication anywhere and everywhere. Number 3 is recovery support services. So this means making sure that counties and programs have peer support specialists or care navigators. And we know that faith communities are great at doing recovery support services and making sure that people are wrapped up with love and support and care. And so making sure that people know about what support groups are available, or if your faith community provides a clothing closet or meals, all these are great ways to make sure that people get connected back into the community. One of the driving sayings in my work is the opposite of addiction is connection. It's not sobriety, it's connection. And so how do we connect people and wrap them up with love and support? Number 4 is recovery housing services. So this is making sure that people have access to kind of those Maslow's hierarchy of needs. So how do we provide people with housing? So this could look like buying a house, but we also know that that's really expensive and really hard to do right now. So how do we think of housing first programs? How do we make sure we get people to stay in the housing they already have? So this could be emergency rent deposits or utilities assistance. We know that a lot of faith communities help people with housing applications. So making sure that your local governments are aware of kind of what the housing needs in your community are. Number 5 is employment support services. So programs and services that help people get into employment. So how could this look like in your community, like job training programs or placements or transportation assistance? And we have an amazing resource in North Carolina called Recovery Friendly NC. So how do we make sure that we have recovery friendly workplaces for people to enter? So number 6 is a very narrowly defined as early intervention. And this is trying to identify children who are already showing signs of struggle. And we know with kids that mental health concerns show up before drug use does. So how can we address those adverse childhood experiences or trauma before a kid starts using drugs? We know that trauma is the gateway drug. So we really want to make sure that we are supporting the young people around us and making sure they have loving and supportive adults around them that can identify when they're struggling and get help. Just to note that early intervention is for kids already showing signs of struggle. This is different than primary prevention, which is the kind of universal training all kids to say no to drugs or educating them about drugs. Early intervention is very targeted and specific. The primary prevention is more of an option B strategy that local governments can pick. Strategy 7 is naloxone distribution. So naloxone is the overdose reversal medication. And this strategy is really focused on making sure we get it into the hands of anyone and everyone, because we know that people who use drugs and their loved ones are the first responders in an overdose. And so we want to make sure that naloxone is available everywhere. We know that a lot of faith communities in North Carolina do blessings of naloxone or naloxone trainings. And so this is a perfect complement to that as well. Strategy 8 is post-overdose response teams. So post-overdose response teams are following up with someone after that really scary crisis of an overdose within the key hours of 24 to 72 hours after an overdose. And it's connecting with the person and linking them to care and referrals to whatever services they might need. And so this is a really great program that local governments are looking into to make sure that people are connected back into the community. Number 9 are syringe service programs. So North Carolina legalized syringe service programs on July 11th, 2016. And we know that syringe service programs are evidence-based, that a person who engages with a syringe service program is 5 to 7 times more likely to be connected to treatment, according to the CDC. So within the syringe service program law, there are some core services that are required that SSPs provide, such as educational materials, syringe access, secure disposal, naloxone kit making, and referrals to mental health treatment and substance use treatment as needed. But I like to think of syringe service programs as a hub. They provide so many more services to the community, such as referrals for medical or support groups or food or health services. And so they're a really great community. And we have several churches that house syringe service programs in North Carolina, which is really amazing. Number 10 is the criminal legal system diversion programs. So these are programs like law enforcement assisted diversion programs, which provide an alternative to incarceration. So how do we make sure that people don't enter the carceral system? Number 11 is medications for opioid use disorder in jail. So this is supporting adding evidence-based addiction treatment into jails and carceral settings. In 2022, the U.S. Department of Justice issued a guidance that a jail that does not allow incoming inmates to continue taking their prescribed medications for opioid use disorder, if they had a blanket policy prohibiting that use, that would be a violation of the Americans with Disabilities Act. So we really want to make sure that our jails and prisons are allowing people this life-saving medication. Number 12 are reentry programs. And so these are connecting people back to services when they're coming back from incarceration and supporting them as they reenter society. A UNC study that was originally in 2018, but just recently got re-upped, has found that people coming out of jails and prisons are 50 times more likely to die of an overdose within the first 2 weeks of leaving incarceration. And so it's really important that we connect people with really essential services and programs and connect them back into society. So on that ncopioidsettlement.org website I mentioned earlier, there is another data dashboard. If you go to that website, you will notice that we love a data dashboard. And that is because transparency and accountability is really key to the North Carolina Memorandum of Agreement. This data dashboard is called the Local Spending Plan Dashboard. And as of July 1, you can see that 79 local governments have reported spending plans. You are able to sort these spending plans by strategy, so you could see what local governments are interested in investing in, say, naloxone distribution. You can even find it by your specific county. So as I mentioned earlier in my brief overview of the reporting requirements, all local governments are required to follow annual reporting. So the first is that local spending authorization report. The intention to say, I intend to spend funds. That report then gets turned into that local spending plan dashboard that I shared with you. And then on my team's favorite day, September 27th, 90 days after the end of the fiscal year, all local governments have to turn in their annual financial report and their annual impact report. So what money did they actually spend this year on opioid settlement programs? And what was the impact of those programs? Those will also be turned into dashboards that you can find at ncopioidsettlement.org. And as I mentioned earlier, this is all about that transparency and accountability piece. So finally, all local governments are required to hold an annual public meeting. This is so that they can inform the public and their municipalities on what their plans are and to collaborate and get input from the public on what they should be spending their opioid settlement funds are. This is a very huge key way that people can get plugged into the settlement work in their local communities, is to attend these annual public meetings and to learn about what your county is thinking about and to share your voice on what you know about of your community. So I really encourage you to see when your local meeting is and to show up. These are some of the resources that I mentioned in the webinar this evening. The first being that ncopioidsettlement.org. I think I visit it at least 3 times a day, if not more. It's a really great website. The next is the North Carolina Department of Justice's website. So if you really want to nerd out and read all the legalese of the North Carolina Memorandum of Agreement, you can go there to More Powerful NC. Our website, the North Carolina Association of County Commissioners, and finally, North Carolina Department of Health and Human Services website. They have great information and county-specific data around overdose. So I am very excited to announce that my organization is going to be hosting the Summit on Reducing Overdose next year, March 18th through 20th. This is the statewide conference where we all come together and talk about the overdose crisis and share what successes we're having. And I really hope that y'all will be able to join us. We will be in Wake County and Raleigh, and it will be a really great time. And I know I just threw a lot of information at you, so I'm happy to take any questions you may have. Thank you so much for listening to me.
Thank you so much, Elizabeth. If anyone has questions, you can come off mute and ask, or put your questions in the chat, whichever you prefer.
I'm June Blotnick. I'm in Charlotte, and this issue is close to my heart in terms of people that I know. What is the sense in terms of how many counties went with, I don't know if you covered that, with A or with B?
Yeah,
Yeah.
I am happy to go through that. So as of July 1, which is the last time we've got updated data, about 77 counties have gone with option A. I think only 2 had submitted resolutions with option B strategies and the collaborative strategic planning to go with it. But I'm pulling up that dashboard right now and we can look at it together.
That's fine. Yeah, because, impact, of course, for it seemed like you said that was targeted for people that are at a high risk for overdose. Yeah, I mean that makes a lot of sense. And the kind of strategies there would be getting the naloxone out there. We do have a nonprofit here that Queen City, I can't remember the name. Queen City
Harm Reduction?
Yeah, harm reduction.
Yeah, they're
their
wonderful.
T-shirt. Yeah. But I've just heard of other counties that just the police or whatever it's not common practice to carry naloxone and that kind of thing. I'm just wondering where we are as a state. I know the money is new, but the problem is old, and just curious.
It's so hard to say like where we are as a state, just because, as you said, this is not a new problem. And so many counties were already doing programming and thoughtful like planning and had programs in mind and could immediately start investing funds. And to other counties, it hadn't been a priority. And so with this new funding stream, you really had to take a step back and say, okay, what does the landscape look like in our county? What do we have naloxone? For a lot of our rural counties, like EMS and first responders going out for an overdose, that can take a long time. And so how do we make sure that we're really addressing the root causes and making sure that people and loved ones have access to naloxone, for example? So I really think counties have taken that really thoughtful planning. And as you can see, more and more are coming online with strategies, and they're more and more doing really amazing things.
Mhm.
So, for example, the Charlottes and who have Queen City and these amazing resources kind of were able to hit the ground running. But we like to say on my team, everybody's right on time, because you don't want people to just spend money to spend money. You want them to actually put it where the impact's going to be. And so
Right.
taking that time to plan has been really valuable.
Yeah. I just have one other question about engaging substance abusers in the solutions, you
Mhm.
know, or what's being done, if anything, in that regard.
Yeah. So part of the collaborative strategic planning process and Exhibit C that I talked about talks about people with lived and living experience as a key stakeholder group that needs to be involved in the planning.
Yeah.
And so different counties have done focus groups with their local syringe service program, where they talk to people who are actively using and are living the experience to find out what are their daily barriers. Is it you need to get to a place and it's a long commute? Is it that your ID got lost because your tent got raided by the police? Like, there's some things that you don't know unless you ask questions and you listen.
Mhm.
Some people are doing community listening sessions all across the community so they can get a broad spectrum of voices.
Mhm.
So I've been really heartened by the thoughtfulness that counties have been doing, and it's also up to us to make sure that we continue to make sure that people's with lived and living experiences voices are at the center. And hiring people with lived experience is a huge,
Yeah.
huge
Yeah.
thing.
Thank you.
Nancy, I see your hand.
Thank you for hosting and being a part of this panel. Mine's a little technical question, and I'm jumping on a little bit late. My apologies, but I'm also sort of getting back into this arena a bit. Many years ago, I worked with prevention grant on medication misuse, and I'm now kind of aligning up with some of the support systems for individuals that are struggling with this. And I'm in Cabarrus County. So when I look at your map and I see my little diamond shaped county green and a circle in it, does that mean that we are both a county and a municipality, or what does that indicate? And I did get on late, so if you can direct me to how I can kind of come to understand where the county is in their process. Should I simply just go to my county website and look at what they've got? I see a press release, but that's about all I see for in the county. So, and again, you're going to share with us the slides, so maybe those websites will take me exactly where I want to go. But
Yes,
yeah.
so I put one of them in the chat. Now, I have to confess, because we are the Association of County Commissioners, I'm better with my counties than I am my municipalities. But I believe, isn't Hickory in Cabarrus County? No,
No,
I'm
Hickory's in
completely
another.
off.
Concord is in
Concord.
Cabarrus County.
Concord. There we go. See, I've been completely indoctrinated by county speak and not municipalities. We
That's just fine.
joke.
That's just fine.
But yes, Concord is one of the municipalities receiving funds.
Okay.
If you go to the payment schedule dashboard, which I'll also stick in the chat, you can see that Concord, starting in fiscal year 23-24, directed its funds to Cabarrus County. And so Cabarrus County's funds went up as a result of that.
Okay. So in that respect, what I'm hearing is I have one place to go, which is the county, and to look at what's being done and to come up to speed, as I like to say, since this is now August in 24 and they started in January.
Yes, and your annual public meeting is going to be one source of information, and the county will be able to update you. But this website has a ton of information as well, and strategy-specific information.
Thank you, Elizabeth.
You're welcome.
Hello,
Hi.
my name is LaWanda McDowell, and I am the campus minister at North Carolina Central University. I work with some other around surrounding colleges as well, Chapel Hill, UNC, and Duke. I'm wanting to get some information about how I could fit into this and working with students that are high risk um, and help with some type of prevention for these students.
So could you tell me a little bit more about what you would be interested in doing?
I'm interested in doing some type of maybe prevention classes, support groups. Um, as you were saying in the slides, that is when they are dealing with trauma at those early ages, and that is one of the ages where they start experimenting when they're away from their parents on campus with actually they start in high school, but um that's a key part area too when they are away from their parents and on campuses with their students, with their friends and their peers. And I would like to do some type of I don't know, maybe classes or prevention, even have the Narcan on site, where we could help with that with the overdose, and I'm open to ideas and
Yeah.
anything that would help with prevention.
So youth mental health first aid is a great training, or mental health first aid that
Yes.
helps identify kind of mental health concerns and how to help. Naloxone training is another great resource. Your local harm reduction organization would be able to help you with that, or your local health department. And then North Carolina also has a really great collegiate recovery group
Okay.
through the Addiction Professionals of North Carolina. And I know that like UNCG has a collegiate recovery center. And so that would be another great resource. I know that at Chapel Hill, the students have been doing naloxone training and training their peers to identify the signs of an overdose and know
Yeah.
how to use naloxone. So I think, yeah, we're hosting a recovery support group on campus. So like a harm reduction work support group or a medication assisted recovery anonymous, or making sure that you have medication assisted treatment available through student health. There's all sorts of options.
Okay.
Mhm.
I'm really glad you're connected with students and able to reach this great population.
Mhm. Thank you.
Yeah, I was just gonna add that, fentanyl isn't, um, it's not just in opioids. I mean, there's fentanyl in marijuana or cocaine or other drugs, and I think that's really important for the young people to know, and that there are fentanyl test strips out there, that they can use, right, Elizabeth?
Yeah, so your local harm reduction organization or Dance Safe is another great resource to talk about fentanyl. We also have a really cool webinar. I don't know if you could get the students to watch the webinar, but called Myths versus Facts About Drugs. And so gives really like concrete information about naloxone and how to use it. So Durham has amazing partnership with the North Carolina Harm Reduction Coalition. And so they're right by you at Central. Hi, Dr. LeGrone.
How are we doing?
Good, how are you?
Doing well, doing well. Apologize for the noise. I'm getting my de-stressing exercise in, but I heard Miss McDowell chime in. And please, I'm going to put my contact information in the chat. We have some innovative programs we're doing at North Carolina DHHS, and that includes campus outreach. So I would love to connect with anyone who want to connect with us. I'm Dr. LeGrone. I'm the state opioid coordinator. And I'm also a pastor of 30 years. So when I saw this faith-based meeting being sponsored, I said, I got to get on and just see how we can help and to see what else is happening around the state. So please reach out to me, and I look forward to participating and engaging. And thank you for letting me have this time. Thank you. Good to
Great
see
to
you.
have you. Good to see you.
Thank you so much.
And Dr. LeGrone's email is in the chat. Also, apologies if you can hear my dog in the background. He is having a good time tonight.
Elizabeth, I'm sorry I have so many questions, but
A-okay.
the other thing I was looking at, I think on the website was which counties have the highest rates of overdose. And I would think Mecklenburg because it's everywhere, but it's not. I was thinking it was Robeson County.
I believe
Right.
that's the Department of Health and Human Services dashboard. And that's
Oh, okay.
a great resource.
Mhm.
And the Injury and Violence Prevention Branch through Department of Health and Human Services actually sends up monthly reports on kind of overdose trends and ED visits. So highly recommend visiting that website, and
Mhm.
the rates are adjusted based on population as well.
Yeah, I was just, I used to work in the environmental field and environmental justice, and I'm familiar with folks in Robeson County and just wondered, so the money is based on the population? Is that what you're saying in terms of the amount?
The money is based on a funny formula created by the attorneys, which is pills dispensed and prescribed and population.
Like
And they
opiate
came,
pills?
yes,
Okay. Prescriptions.
opioid prescriptions. And they came up with this magical formula, and population plus pills dispersed plus overdose numbers was the
Okay.
magical formula.
Got
And
it.
that has how all the funds got distributed between the 100 counties and 17 municipalities.
Mhm.
And if we have any faith leaders or clergy on the call and you're interested in, kind of getting your congregation or your faith community involved in helping being able to advocate to make sure these funds are going to the most appropriate local resources or agencies, you can always host a kind of a community forum. And, I'm sure Elizabeth would be more than willing to give you some more information on, things that you can do around that. And so would I. You can reach out to either one of us and, you know, just inform your community and your congregation a little bit more on what's going on with all of this. And a lot of, as Elizabeth said, a lot of the counties are doing great things and doing things the right way, but we just, want to always be an advocate to make sure that people are being helped, and that every community, every county is doing it the way that it's intended to be done. And Elizabeth, do you mind to put your email in the chat?
Sure.
This is Wanda Williamson, and I'm from sort of two counties. I'm a congregational nurse, and whoops, I'm sorry. I don't know what happened. Anyway, I'm sort of like from two counties, and I'm a congregational nurse in Guilford County and Rockingham County. And I was wondering, I don't know about. So, what did you say? I find the stats on those counties and the places, and I don't know whether they. I don't know that they know about this or not. But and you said we could. How are they getting the information? The different places in Rocket and Guilford.
Yeah, that is a great question. So my organization provides technical assistance to those counties, and so we make sure that they are up to date on the most recent information and know kind of that reporting is due, and if they have questions, they can come to us. Um, in terms of kind of overdose numbers or what the health outcomes look like in those counties, you can go to the NCDHHS Substance Use Action Data Dashboard, which Stephanie put in the chat and I just put back in the chat. For more specific information around kind of opioid settlement funds, for example, how much money is coming to those counties, you can go to ncopioidsettlement.org. And there's a payment dashboard schedule that I just stuck in the chat. And then if they have submitted plans, which I believe Guilford has, I'm not sure off the top of my head about Rockingham. You can find that information here, and I am sorry for just putting link after link after link in the chat. But this local spending plan dashboard, you can drop down the menu and click on your 2 counties, and it will show you what their plans are, and you can even click on the document to see when they submitted it and kind of what they're thinking about.
Yeah, Rockingham County has 2 strategies that were authorized, and those were Exhibit A strategies. So if you go to the whatever link it was that ended in spending plans with the pink map, you just hover over those counties and you'll see the dates, like the timeline when they submitted information. There you
This
go.
is the lovely website.
Yeah. The pink chart there. Mhm.
So you can scroll down and there's a wealth of information here.
Great, thank you.
Hi, my name is Darlene Lysette, and I am just so excited to be on the call tonight. I have a long history of working as a mental health therapist counselor. I have a nonprofit. We work with veterans and churches and congregations. So we're becoming engaged in the settlement and working along with our local health department. So thank you so much for the invitation, and looking forward to spreading this out to our rural communities that can be very impactful in getting the word out and getting the resources out for your plan of actions and working to improve the outcomes.
Thank you so much for being here, and thank you for the work that you do.
Thank you.
Well, thank you all so much for being on tonight. And Elizabeth, thank you so much for the wonderful presentation. Elizabeth did put her her email in the chat. So if you need to reach out and ask her additional questions, I'm going to put my email in the chat as well. And then we will send out the slides and any resources for everyone who signed up for the webinar this evening.
Thank you.
Thank you
Thank you
all.
all.
Hope
Yeah,
you all
thanks
have a
so
wonderful
much.
evening.
Thanks for doing this ministry.
Thank you all
Thank
so
you
much.
so much. Yes.
Really
Everything.
appreciate it.